like to explain to me why we had this appointment right now?
Yes, I'm here because of Addison's lack of management. I'm speaking for my whole department. We all feel this way.
Really?
Yes, it's been a big problem lately. She's been nowhere to be found. We've been having all kinds of issues. We've been emailing her, getting no response. She recently cut one of my breaks.
She cut one of your breaks?
Mm-hmm.
Wow. Okay.
Our schedules are a mess. No one knows when they're working. She's extremely unresponsive, unorganized.
Now, how long has this been going on for?
It's been going on long enough for all of us to come together.
Oh, this is not good. Okay.
And we just feel in general she doesn't care.
And you're saying everyone in your department agrees with this?
Everyone feels this way.
Okay. Wow. All right. Well, this is definitely some information that I need to relay to Addison immediately. This needs to be addressed. This needs to be fixed because it's not really how we run things here. I'll make sure that these complaints remain anonymous, and I'm really glad that you brought them to my attention.
Thank you.
So I'd like to thank you for your time, and I'll let you know how this goes. Now, do you guys know why I brought you into my office today?
I certainly do not.
I don't.
Okay, well, recently I had an employee come in with the consensus of the rest of the department commenting on your lack of performance on the floor at Addison. She and everyone else she was representing said how you were non-responsive and unorganized, and you had an attitude where you don't really care, and it seems like you're giving the employees a hard time and making their jobs more difficult.
Excuse me?
Hold on. I've even heard that you took away some of their lunch break. Now, what is that about?
Okay. I tend to use negative reinforcement, which has worked in other job settings, and it's never been an issue before. And I take away an award, such as a lunch break, for bad behavior when, they don't file papers correctly or when they're not on time for work in order to decrease that behavior over time.
Okay, well, I know what negative reinforcement is, and that is not something that exactly works in this hospital. We have an organized structure where we want to work together harmoniously. We don't want to have one person not working with the rest of the group because that will cause problems. It doesn't matter what kind of guidelines you work by in your other job. We do things the way we do here, and it works efficiently. And we need you to be part of the group. And that is why I brought in Katie here, because she has been a manager here at this hospital for a few years now, and she's got this managing thing down pat. And I want you to take her as an example. She has some very fine leadership skills that she would like to explain to you.
Well, I think in order to be a good manager, it's important to possess both managerial skills and leadership skills. It's important to influence and guide your employees and set the direction so they know exactly what the goal is. I also think in order to be a good manager, it's important to be in the environment and see for yourself what is going on in order to best fix a problem when it does come up.
Yeah, may I just say, you can't just be their manager. You must be part of the employees' jobs. You must be there for them when they need you, not when they have to come find you and they can't find you.
I mean, basically, I think everyone is an adult, and I trust them to do the work on their own. I don't have to, it's not like we're in kindergarten and I have to watch them all and babysit. That's not how I manage. I think I manage just fine.
Okay, well, I also think that you need to take some of these things into consideration, because this is how we work around here, and in order for our system to be efficient and effective, there needs to be communication, there needs to be organization, there needs to be compassion between employees. You need to be a leader, someone they can look up to, and from what I'm hearing, that's not happening.
Okay. Well, I take this meeting seriously, and I do not want to be terminated in any way. So I guess I will pay more attention to my team members' needs and hear what they have to say and be more present in the workplace.
It would be much appreciated. I will be keeping an eye on your performance from now on out.
Okay,
Have a good day,
understood.
ladies.
Thank you.
Thank you.
You're welcome.
Check out my man getting his leadership on. First, he hits them with a little preparation.
Are there any more questions about evolving treatment therapies?
Next, inspiration.
Now, I just want you to know you guys all have the potential to be amazing doctors.
And finally, a dose of fear.
Okay, I'll see you guys.